today's video demonstration, I will going to demonstrate the routine procedures of the forearm, namely AP and lateral or lateromedial projections. Good afternoon, sir.
Good afternoon, sir.
Sir, you may sit down po, sir.
Thank you very much.
Thank you po. May I ask, sir, what is your language preference?
Bisaya.
By the way, sir, I am John Pulguikoy and I am your red tech for today. And for patient confirmation, I will going to ask you what is your middle name, age, and date of birth.
My middle name is Santos and I'm 24 years old and 1992.
Thank you po, sir. Pwede na po ngayon ang requisition form, sir.
Yes, sir.
Okay lang ba mag-Tagalog po, mag-Bisaya po, sir?
Yes, sir.
Thank you. And, asa na part gani, sir? Ang imuhang ipa,
Forearm
right or left?
sa left.
Okay, thank you po, sir. Sir, mawatanap, sir, kung napakay difficulty breathing na paano ka ron?
Wala naman.
Wala po. Heart attack, previous
Wala.
Nag-smoke ba ka, sir? So, balik ko na ko, sir, ha? So, ang procedure will be at your left forearm. Okay. And, tungod man na sa injury, sir, no? Or na trauma. So, before to mag-start sa atong procedure, sir, i-instruct na kada answer na maminaw dyan ka sa akong mga i-instruct. And then, narito ato ang dressing room and pwede ka mag-change dito ang patient gown. Pero sa ato ang procedure ka lang, sir, forearm naman, so no need na ta mag-change into patient gown. And, instruct na po na kada answer nga tanggalon na to ang ato mga metallic objects like mga singsing or anything. Wala man kaniagi og surgery, sir, no about sa. So, kato lang, sir, sigurado na to nga walay mga singsing or metallic objects sa inyong mga kamay. Noted po, sir. So, good afternoon, sir. Mao din ni ato ang thyroid shield, which is ibutang na ko siya sa inyong liog, sir, para maprotektahan yung thyroid against the radiation. Kaya ang thyroid mo, good sir, is very sensitive to radiation. So, butakan ka kag-lens shield na thyroid shield. Then, kanipod, sir, is the gonadal shield, which is, ang gonads mo na to, sir, labi na kanang testis is sensitive siya sa radiation. So, ato siya protektahan. So, magbutang ko, sir, ha? Okay lang ba, sir?
Okay.
Mag-touch. Nagbutang ko, sir, ha?
Sige, sir.
Thyroid shield.
Sayang ko po pa, sir.
Then, mabutang po kung gonadal shield, sir. Ikaw na lang butang, sir, sa imuhang gonads.
Go.
Today is, we will going first to demonstrate the AP forearm. The cassette that we're going to use is 14 by 17 inches portrait or 30 by 35 centimeter or 11 by 14 inches. So, today, we're using the 11 by 14 inches, then naka-portrait. Then, this procedure is a non-grid, so we don't need to use a grid for this. And as you can see, the patient is positioned in seated at the end of the table with arm extended and hand supinated. So, shock ta ka, sir. Pakibutang sa imong kamot diri sa atong IR, sir. Okay, nastated na siya. The next one is ensure that both the wrist and elbow joints are included. Use a large IR as required to include both wrist and elbow joints and have the patient lean laterally as needed for a true AP forearm. So, make sure that the epicondyles is parallel to the IR or directly to the IR. Then, in collimation, the central ray must be perpendicular or centered to the midpoint of the forearm. So, the central ray. And make sure that you include the wrist and the wrist joints and the elbow joints in this procedure. Then, the SID that we're going to use is 40 inches or 102 centimeter. So in collimation, collimate on 4 sides including a minimum of 2.5 centimeter or 1 inch beyond both wrist and elbow joints. And do not forget to put the lead marker on the collimated side. As you can see, so shoot. On the anatomy demonstration, there should be a visible brightness is uniform across the entire forearm, as you can see on the radiograph. The radial styloid is demonstrated in profile laterally, as you can see. There should be a superimposition of the metacarpal bases of the radius and ulna is minimal. The radial tuberosity is demonstrated in profile medially. Radius and ulna run parallel. Ulnar styloid is projected distally to the midline of the ulnar head. 1/8 or 0.25 inch of the radial head superimposes with the ulna. Olecranon process is situated between the olecranon fossa. Coronate process is visible on end. Forearm midpoint is at the center of the exposure field. Wrist and elbow joints and forearm soft tissues are included within the exposure field. The next procedure that we're going to demonstrate is the lateromedial forearm or the lateral. So the cassette that we're going to use is 11 by 14 inches. Portrait for smaller patients, and for large patient is portrait as well. This procedure is do not use grid, so this is a non-grid procedure. In patient positioning, the patient must be seated at the end of the table, shield on the patient's lap, then elbow should be flexed 90 degrees. Sir, position na to, sir. And the elbow should be flexed 90 degrees, as you can see on the demonstration. Hand and wrist must be in the true lateral position, wherein the distal radius and ulna should be directly superimposed. Ensure that both wrist and elbow joints are included unless contraindicated. The central ray must be perpendicular to the center midpoint of the forearm. So you can see. The next one is the SID that we're going to use is 40 inches or 102 centimeter. In collimation, collimate on 4 sides including a minimum of 2.5 centimeter or 1 inch beyond both wrist and elbow joints. So make sure that you included the wrist joints and the elbow joints in this procedure. And do not forget to put your lead marker. Sir, ayog lihok, sir. Then, shoot. In the anatomy demonstration forearm projection, there should be a brightness is uniform across the forearm. The anterior aspect of the distal scaphoid and the pisiform are aligned. Distal radius and ulna are superimposed. Radial tuberosity is not demonstrated in profile, as you can see on the sample radiograph. Ulnar styloid is demonstrated in profile posteriorly. Elbow joint spaces is open. Anterior aspect of the radial head and coronate process are aligned. Forearm midpoint is at the center of the exposure field. Wrist and elbow joints and forearm soft tissues are included within the exposure field. Sir, done na po ato ang procedure, and thank you kayo sa cooperation, sir. And By the way, sir, ang result will be 2 to 3 hours pa po bago makuha, sir, kay basahan pa sa radiologist.
Okay.
Okay lang ba, sir?
Okay.
Okay. Thank you po, sir.
Thank you so much then.